Hi everyone. In this video I'm going to talk about high flow oxygen therapy device, also known as high flow nasal cannula. So this system consists of two parts. One is the oxygen blender and the second part is the humidifier. So the oxygen blender is connected to wall oxygen outlets and medical air outlets. And then the blender has a flow meter which you can use to control the flow rate. It can go up to 100 liter per minute. Typically you'd see people using 60 to 70 liter per minute, and you can control that using this knob. And then you have another knob which you can use to control the oxygen concentration level, or a FiO2, that can range from 20 to 100, that is 100% oxygen. Typically you'd use 60 to 70% or even 80% depending on the recommendation. So the oxygen blender, as I said previously, connected to the wall oxygen and medical air inputs. So the output of the oxygen blender goes to the humidifier, and then in the humidifier the patient circuit is connected with the other end of the humidifier. One important thing to note is that in this setup we have a temperature sensor which actually measures the correct temperature for the patient. And with this patient circuit is connected with this nasal prongs or nasal cannulas, which is connected with the patient. So I'm going to start up the system to just highlight a few things. I'm going to start up the oxygen from the wall and also the medical air. So now the system is up and running, and I can feel that the blended gas is coming out through the cannula. Now, as you have just noticed, if the pressure from one of the oxygen or medical air outlet drops, the blender gives an alarm. Let me just show you again. So if we reduce the oxygen flow, it will give you an alarm. When the flow comes back, it goes back to normal. The same way, if the pressure from the medical air goes down, it will give an alarm as well. So this is very important to note. If your blender is giving you an alarm, it indicates that the pressure is not correct. It needs to be fixed. Second thing we have to remember is that the blended gas has to be properly humidified. Otherwise, it can actually have some detrimental effect on the patient. And the third thing is, it blows air at quite a high flow rate, so the clinicians that are supervising the patients have to wear proper PPE, or to be in particular N95 masks when treating patients with high flow nasal cannula systems, to protect themselves from any aerosols generating from the patient. Let me know if you have any questions. In the next video, I'm going to show you how to do a low-cost high-flow nasal cannula system, or high-flow oxygen therapy system, and I'll be replacing this expensive blender with some other devices in the next video. Thank you.